This video has been developed for people recovering from heart surgery. Whether you've had bypass, valve, or another type of heart surgery, the guidelines are similar. If you have specific questions, please ask a healthcare practitioner.
Everybody has a different kind of recovery, and you have to follow what you feel is right for yourself.
You may have odd physical problems of one sort or another, but they'll pass.
Now I play hockey 3 days a week.
Now that you've had your heart surgery, it's time to focus on your recovery at home.
Well, thank you very much, folks. You've been a great team.
Even if you've been looking forward to this moment, you and your family may still have some mixed emotions and unanswered questions.
Am I really ready to leave?
How would I cope?
How will I know if I am healing properly?
When will I be fully recovered?
Your healthcare team has evaluated your progress and has decided you are ready to leave hospital. As to how long you'll spend recovering, each person is different. How much time you'll need will depend on such factors as your age, your general state of health, activity level before surgery, and the progress you've been making while in hospital. Recovery from heart surgery usually takes between 6 and 12 weeks, but may take longer for some people. Before you leave the hospital, you'll receive written information about your recovery, and you may attend an information session. Here are some frequently asked questions and answers to help you in your recovery. We encourage you to refer back to your written material for additional information.
What kind of help will I need when I get home?
Is it okay for me to be left on my own?
Even though you won't need nursing care, for the first few days you may wish to have someone available during the day and at night to provide emotional support and help with cooking, shopping, and other household activities. As time goes by, you'll begin to feel confident and more relaxed about spending time on your own.
Suddenly you're almost on your own, and I was anxious in some respects, but I really was so happy to get home and to be with my husband and our little dog and just be in my own home.
Is it safe for me to climb the stairs when I get home?
Yes, it's safe to climb the stairs. If you're concerned about climbing the stairs, ask a member of your healthcare team before you go home. And once you're home, if you're tired, try to organize your day so that you don't have to be constantly going up and down the stairs. And remember, don't get discouraged. Measure your progress on a weekly, not a daily basis. When I get home, how should I look after my incisions?
Continue to care for your incision or incisions as you were taught in hospital. Wash gently with water and mild unscented soap. Don't use any lotions or creams, including vitamin E. To relieve itching, place a cold wet cloth over the incision. For the first month, take lukewarm showers only. Hold off on tub baths until your incisions and breastbone are properly healed, usually at about 6 weeks. When you travel by car, keep a small pillow or folded towel between you and the shoulder belt to prevent the strap from rubbing against your chest. Keep your incision away from excessive sunlight for a few months. After you heal, always use sunscreen on this area, since scar tissue is more susceptible to sunburn.
You may find that your incisions are itchy, bruised, swollen, or draining a small amount of clear or blood-tinged fluid. These are all common reactions to surgery and should soon disappear. The redness of the scar will gradually fade over the course of the next several weeks. You will have either self-dissolving sutures or staples in your chest incision. If you've had bypass surgery, you will have sutures or staples. Self-dissolving sutures are not removed as they will dissolve within the incision. Your family doctor will remove your staples usually 10 days after your surgery.
What is going to happen with all my medications?
Before you leave hospital, all your medications will be reviewed, including the ones you were on before surgery. You'll be given prescriptions for the medications you need to take.
The types and amounts you receive will depend on your condition, and these prescriptions may be changed as your recovery progresses. If you have questions about any of your medications, ask your hospital or community pharmacist. Make sure you know the name of each medication and why you need to take it, how and when to take it and for how long, foods, drinks, and activities to avoid while on the medication, and what the common side effects are and what to do if they occur.
How much can I do and how much should I be doing?
And why do I feel so tired?
Once you're home, the goal is progressive activity, trying to do a little more each day. However, the general rule is to do everything in moderation.
Don't compare yourself to anybody else. Everybody has a different kind of recovery, and you have to follow what you feel is right for yourself.
Rest is important too. During your first week home, try to get a good night's sleep each night and plan 1 or 2 rest periods each day, depending on how you feel.
Even if you're getting enough sleep, it's very common to still feel tired after surgery. This is because you've had a big operation and also your blood count may be a little low after surgery. In other words, you may be anemic. Over the next couple of months while you're at home, this should get better as your blood count comes back up and you start to get a little more rest. But some people don't feel normal or back to their old self for a few weeks and up to 2 months sometimes.
The best way to overcome fatigue is to gradually and steadily increase your activity level. Regular exercise also improves oxygen use throughout the body, lessens the load on the heart, and helps you manage stress. Keep doing your breathing exercises to expand your lungs, and remember that good posture makes breathing easier. Also, continue to do the exercises you were shown by your nurse or physiotherapist. Arm and shoulder movements help prevent stiffness. Calf pumping exercises increase circulation in the legs and feet. You'll find instructions on how to do these and other exercises in the booklet given to you by the staff at your hospital. The best exercise after surgery is walking. Wear shoes with good support and light layered clothes that you can take off and put on as necessary. At home, you should be walking daily. Start with short, frequent walks several times a day. Then, as you feel up to it, start making the walks longer. By 4 to 6 weeks, it's usually possible to walk 30 minutes at least once a day. Once you can do this, you may gradually increase your walking speed. To make sure you're not overdoing it, follow the walk-talk rule. This means you should always be able to walk and talk at the same time without feeling short of breath.
Walking helped me a lot. And you should do the same thing. You should walk. But you shouldn't limit yourself. Unless the weather is bad and if it's icy, go inside. And go to a museum, go to a shopping center, but just walk. It helped me a lot, and it will help you.
As you feel stronger, you can progress to other conditioning exercises. Ask your doctor or cardiac rehab specialist for guidelines on more vigorous activities, such as swimming or jogging. During the healing phase, your heart is more sensitive to exertion. It may not take much activity to make your heart beat faster. Stop exercising if you feel pain, nausea, extremely tired, short of breath, dizzy or lightheaded, or a feeling that your heart is racing. As a precaution, do not exercise outdoors in extreme weather conditions. Wait 1 hour after a heavy meal.
How long will it take for my breastbone to heal?
It takes about 6 to 8 weeks for your breastbone to heal. Remember that after your heart was operated on, your breastbone was wired together with stainless steel sutures, which will stay in permanently. During the early healing period, you may feel a slight click with some upper body movements. This feeling will disappear as the bone heals, but in the meantime, you may find that you need to continue to support your chest whenever you cough or sneeze. Women should wear a loose, comfortable bra.